Steve.
Hello.
Hello.
Hi, Dr. Steve. How are you,
Hello,
sir?
everyone.
Hello, everyone. I want to thank you, Dr. Steve, for the little gift. It was a sterling silver coin, a Trump coin that he sent me, and I was thrilled with it. It's awesome. Thank you. Thank you, Dr. Steve.
This is the goofiest thing I ever saw. It's 0.995 pure silver coin.
Yeah.
In the same, it's an ounce of silver, and it's got your old buddy's face on it, and he's got a very stern look on his face.
Donald Trump. Bill Devane would fucking cream over it.
Oh.
Yeah.
Siltage jizz.
Bill Devane.
And I asked you this. On his commercials, he always says, well, Lear Capital, there's no nonsense. And it's like, what the hell nonsense has he ever encountered when he's buying gold before?
You buy gold? He's like, what are you doing? I'm trying to buy some gold here. Well, you're an asshole. I don't need this nonsense. Let me go to Bill Devane.
Where dogs play football.
Exactly. Anyway,
Dr. Steve, I know you're a busy man these days. Everyone wants Dr. Steve on their show. He's a doctor and he knows how to broadcast. Jesus Christ, that's gold right now. Talk about gold. But we were talking. Now, I want you to vouch for me. I was mentioning this zinc and quinine, the chloroquine, a couple of weeks ago.
Yes.
Like, I mentioned it to Dr. Steve. I go, what do you think about this? I'm reading some interesting stuff on this.
Yeah.
And now it seems to be the thing that everyone's talking about.
Yes.
What's your take?
The curve on that, and it was actually there was some evidence going back to the SARS, the original SARS, epidemic. That was an epidemic. It wasn't a pandemic, and. That showed that chloroquine, which is an anti-malarial drug, can disrupt the viral RNA and might be an effective drug. The problem is that when you've got, let's say right now, and I want to talk about this too, let's say it's a 3% mortality rate. It's probably a lot less than that.
Yeah.
But of the cases that we know of, 3% don't make it. So that means 97% of people make it. So when you give, like, you got a small sample size, 100 patients, 200 patients, and you give them this drug and they get better, it doesn't really tell you very much because, they might have 97% of them would have gotten better anyway, and out of 100 patients, there's a small chance that all of them would have gotten better anyway. So you need to treat thousands of people before you can sort of tease out that small effect.
But now, Dr. Steve, can I interject here for a bit?
Of course.
You say, the survival rate for people that get it, but from what I've read about this treatment, you don't actually get it. You get it into your system, and then at that moment when the RNA is supposed to link up with your genetic material in the cell, it can't do it because the zinc is kind of blocking it. So can't they tell if that's happening instead of someone just getting it and being kind of asymptomatic?
Well, I'm not 100% I understand the question, but the medication, this hydroxychloroquine, is the one that we're really talking about, which is an analog of chloroquine. It's called Plaquenil. It's on the market for rheumatoid arthritis. They've proposed that they use it in healthcare workers and people on the front line as a prophylactic treatment, that you take this stuff and to prevent getting it.
Right.
So it's going to be very interesting. This whole thing, I don't want to be too overly optimistic. Mm-hmm. But if there's two things that are getting ready to happen. One is that there's a company, and I'm interviewing this guy on my show tomorrow at 7:30 in the morning. I'll put it out as soon as it's ready. That is bringing an IgM and IgG test to the United States. Now, what is that? Okay, so the test that they're doing on COVID-19 right now is a thing called polymerase chain reaction. That's where you stick a swab up your nose and in your mouth, and then you're looking for viral RNA, and you put it in this machine that amplifies it, and then you can detect it. Well, there's another kind of test you could do, which is looking for antibodies to this. And Dave actually alluded to this yesterday, which I thought was quite astute of him. He's quite the bright young man. But that if you can determine that someone has already had antibodies to this, they've been exposed to it. So this test that's coming out will test for two kinds of antibodies, IgM, which are antibodies that you produce when you're just getting an infection, and then IgG, which are antibodies that you get after you've cleared an infection.
Oh, see, that's interesting. That'll know if you're getting it or you had it.
Does that mean an old lady's
dying? You
dying?
can actually tell if someone has a current or recent infection versus a cleared infection with this. So that was the second part I kind of was alluding to is what if, so let me back up for a second. And we'll just use small numbers to make it make sense. So we're saying 3%, right? That's sort of the number that's been bandied about.
Yeah.
So you have 3 people out of 100 people that got sick enough for us to test, and 3 of them, and those 3 people die. Well, what if we start doing this IgM and IgG test and find out that denominator really should be 1,000 instead of 100? This is a big what if.
Now it's 0.3% instead of 3, right?
And then we're way closer to influenza numbers, and people give 2 shits about the fact that 30,000 people are already dead in this country from influenza this year.
Right, and you know what you'll have? 100% of pissed off fucking people, because I swear to you, I was writing about this last night on Twitter. I said, we are in a situation right now where people have been quarantined, they're home. It hasn't been that long. It's been since Monday, where really the 4th day of this quarantine. And I'm already seeing some signals out there here in New York City that aren't good. It's a depressed public. We're kind of heads down, very robotic for the people that are still coming in to work in the city. But I said, we don't have much patience here in America. And when people tell us to do things and we can't move along and live our lives, we get mad. Now, in traffic, what do? We sit in traffic, we start getting mad, and we reach a point where we go, when I get up there, someone better fucking be dead.
Right.
That's what this is. We're in a traffic jam. We're quarantined at home, and we need to start seeing dead people, or we're going to be really mad.
That's
and it sounds terrible, but if we don't have some kind of a medical cataclysm in this country where the death rate perks up a little bit, you're going to have people start second-guess this policy and getting very mad that their businesses are gone, their jobs are gone, and their money is gone.
Oh, yeah.
But I think the way to play that for the public, if I were advising anybody, would be to get those tests out there, get the medication out there, and encourage its use if the numbers really do hold up, and we'll know in the next week or 2. And then declare a win. Hey, everybody go back to work. Look what we did. We just won.
Right. You know? And then the conspiratorial shit will last for eons after that.
Which will be fine.
Because it's one of those things that if it works, you can't prove that it worked. The fact being successful means nothing changed. You know, we didn't have a bunch of deaths. We didn't have this. So it's a very weird thing. I was saying it's kind of akin to a guy coming into a store with a gun and a gun owner shoots him in the head and goes, wow, he prevented this unbelievable massacre of people. And it's like, well, you don't know, because it didn't happen. So
look at the alternate universe where the guy actually shot everybody up. Right?
Yeah, you need the alternate universe version to actually see if it was successful or not. But like I said, people are very conspiratorial. They're very angry. They don't like being inconvenienced. And I don't give people more than 10 days before they start fraying around the edges a little bit.
Yeah.
And when you hear some of these projections of 8 months, which I know is bullshit, they go on and on with these things exaggerated.
Well, that's the news just trying to terrorize
the news is trying to scare people. But even half that, 4 months, a quarter of it, 2 months, I don't see Americans being able to deal with that. I just don't see it.
No, and I have a question, Dr. Steve, with Zinc. I take that every day. Am I doing something then, or is that just sort of a placebo effect?
The hypothesis on zinc is that somehow it decreases the virus's ability to latch on to your mucous membranes. So the way I've seen it, and the data on this isn't great, but, you know, what the hell, it isn't going to hurt anything, is that for it to work, you have to dissolve it on your tongue and then let it sort of coat the mucous membranes in the back. Just taking it in a pill and swallowing it probably isn't doing anything. But nobody really knows the right answer on that.
Without because I heard the chloroquine, because zinc is a positively charged ion, and the nucleus of your cell is also positively charged, so it's gonna. It's going to keep it from, it's going to keep it apart. And then the chloroquine is supposed to open up this little porthole through your cell wall where now the zinc can get in there. Yeah, that's what I heard, Dr. Steve.
Well, that's a very fanciful and colorful description of it. Who the hell knows?
I know. That's just it. And by the way, that's
what
just
I'm saying
it.
Is chloroquine's got good data, and zinc has got sort of shoddy data, but zinc isn't going to hurt you.
Yeah. Yeah, I've heard so much shit, and we were just talking about how you go onto social media and people actually call your theory horse shit and you're an idiot, and then you go, well, what the fuck do you know? Like, I get theories and go, Anthony, what do you think? And I'll go, it's as viable as anything else. Like I don't fucking know. And then people, you're a fucking idiot because, doctor, what do you have to say? Doctor, my booger's asshole 522? Yes, doctor. Let's concur on that. We'll confer and concur.
So what do you think then, doctor, is the best offense, if you will? A good defense, I guess. What would you? We're just washing your hands.
Still, we need to pay attention to the data that's coming in on some of these treatments, and we need to get the test kits out there so that. But now, in the UK, these test kits. By the way, it's one drop of blood, and you can do it in a doctor's office. And hell, I think they were just selling them to people.
Wow.
I don't know the truth of that, but I saw a UK website where you could just click and say, order now. So I'll know more after I interview this guy tomorrow if it's going to be available to the public. But in the meantime, this is a coronavirus. It's transmitted the same way all coronaviruses are, through person-to-person contact for the most part. So you do want to just, if somebody is hacking and coughing, get out of their presence. Wash your hands frequently with soap and water. If someone's touched something, wipe it down or wash it. The soap is really the best defense against this stuff because of its lipoprotein coat is just completely defenseless against soap.
Yeah.
Which is even better than alcohol or bleach, to be honest with you.
I have another question for you that I've been puzzled by and have not really been able to find an answer online. Let's say a place like Wuhan, China, which now is, who knows what the fuck the truth is, but let's just go on what they're reporting. Their numbers are down. No new cases were reported yesterday. They've had some cases of people coming in that have it, but they have
were still old cases because they weren't new.
They had no new cases sprouting up. Now, my question is, how does it not just start up again? Because I understand there are certain people that will build up an immunity to it if they had battled it, but there are other people, especially like in this country, we've quarantined people. We're hoping people do not get exposed to it or get exposed to it at a slower rate. Now, let's say, like in Wuhan, they go, well, no new cases. Wouldn't it take one fucking little guy again to get in someone's nose to start this whole fucking thing up again?
It's a damn fine question.
Well, okay, so I have a hypothesis, and it's only a hypothesis yet to be tested.
Yeah.
If China right now, their curve flattened out at 80,000 people. Okay, out of 1 billion people,
their ass is flattened out immediately.
80,000 people.
Talk about flattening the curve. The Chinese women have been doing that for years.
Just the asses?
Yeah.
Have you seen Chest and Face?
Old Dr. Chest and Face. Yes, Steve, I'm sorry to inject a little humor in your clinical...
Totally fine. So 80,000 people out of 1 billion, that's like 0.0008% of the population. What if the reason that nobody else is getting this virus right now in Hunan is because, remember when we talked about that denominator being 1,000 to make it 0.3%?
Right.
What if it's 100,000? What if there actually is herd immunity around those people to the point where this thing was so widespread, but the vast majority of people were asymptomatic. And again, until we start testing a lot of asymptomatic people, we won't know what the true number of that denominator is.
Yes,
that's kind of my hypothesis right now.
That's a good hypothesis, and that's something I've been talking about on on social media. Also, people want to keep throwing out this mortality percentage, and the real truth is, until you know how many people have gotten this, it's impossible to figure out an accurate mortality rate because you don't know how many people have it. If you tested 10 people and 2 people have it and 1 person's dead, it's a 50% mortality rate. Now, if you test 100 people, 1,000, 10,000 people, and much less have it, it's not as dramatic. So until you know that, throwing out mortality figures is kind of ridiculous.
Is the mortality figure also, with the mortality figures, is it also like, could it be complications with what they had? Could it also be the flu and they're just saying it's coronavirus? Like, are we 100% sure?
Most of these, they're testing people for corona after they've tested negative for flu, even though they have a flu-like illness. But let me give you one thing that sort of supports what you're saying, Anthony. And that is the Diamond Princess. Now, 2 podcasts back, I had a physician who was on the Diamond Princess. He's 70-something years old. His wife got the virus. He didn't get the virus. But they tested every single person on that cruise ship, and only 17% of them, even after all the sucking and fucking and drinking, and sharing, and hugging and kissing and drinking off each other's cups, only 17% of people got it.
Interesting.
And of those, 1% there was 1% mortality, and those people were elderly and had some significant medical problems.
Yeah.
This isn't like herpes at an orgy. This is just
the gay cruise.
If you look at that's right. It's very much like that. So if you look at that as a microcosm for the whole universe of human beings that have been exposed to this. A lot of people, he was in the room with her the whole time and didn't get it. So, it's and the 1% of people, you assume that since most of the people on that cruise were older, that when you look at the general public, that mortality rate would be even lower, and the sample size is still small compared to the United States or China. So.
Yeah, what do you think about that other thing that people have been talking about? Like, instead of having quarantined the entire population, quarantine the people that are most susceptible to getting it or the highest danger of complications, like the elderly and infirmed and whatnot.
England's doing that,
instead, I'm not sure what England's doing. We have this guy, Denzel, on the phone. We'll take his call next from the UK to kind of update us on what's going on there. But what do you think about that tack instead of telling everybody and pretty much tanking the economy, destroying the unemployment numbers, and leaving some people destitute? Maybe that might have been a better, and I know it's a personal opinion, but what do you think?
It's an abundance of caution because they're still concerned that this thing is highly contagious. So I'll just give you what their reasoning is. So we had, during the swine flu pandemic of 2009, we had 60 million people get the virus, and about it depends on the number that you look at. Anywhere between 12 and 40,000, up to 60,000 is estimates, died from it.
Low percentage.
Now, a very low percentage. Well, if this thing has, as they thought originally, 3% mortality, that's going to be 30 times more deadly, even though the number is low, than influenza. So instead of having 30,000 die, you're looking at 900,000 or as much as 1.8 million people. And that, when you have that happen all at once, that would completely collapse the hospital system. And then, I get it. It's all people our age, my age and your age. We're a bunch of old assholes, so who cares if we die? But if we're clogging up the ICUs, then people with other things like appendicitis and regular pneumonias and broken knees can't get treated. So it would just have a domino effect. So that's what they were worried about, and they're still worried about it. We don't know 100% that I'm that I'm right, that my hypothesis on this is right.
All
but I
theories.
do think we will know in the next 2 to 3 weeks.
I think it might be sooner than that. I'm not sure if some
Maybe
government.
I just don't want to get people all.
I understand. You're a doctor. I'm a radio host.
There you go.
I can say a lot more stupid things than you, and I have, doctor.
Say we're going to be fine tomorrow.
Yes, it's all gone. Everyone, leave your homes. I could say that.
Nobody can hold me accountable.
You can't fucking. Yeah, no one's gonna hold me accountable. I'm an idiot. I'm a proven idiot. Yeah. I think the government's gonna have to do this weird balancing act on keeping the public safe from the virus itself and keeping the public safe from the public. I don't think it's we're not quite robotic enough to just put up with shit because someone told us to. Initially, we bend right over. I see it. It's fine. But as time goes by, and we've seen this with Hurricane Sandy, as time goes by and our conveniences and some of our liberties are dispensed with, we start getting mad. We start getting very angry. And there's going to have to be a balancing act where the government says, is this worth what we're going to suffer because we're telling people they can't do things, or people dying?
Well,
it's a balancing.
I'm more worried about the jobs, because if you take away people's ability to live, you take away their reason to want to live.
Yes, very
And that's
desperate.
when they get
become
very,
desperate.
very pissed off.
Yes, they become desperate.
And I don't blame them.
No.
I really feel for the service workers and people that live off tips right now.
Crazy.
And when we go do takeout, which is what we can do here now. I mean, our restaurants are mostly still open, but a lot of them are shutting down. And, if I go do takeout and my bill is $60, I'll tip them, 100%.
Oh, yeah.
We had one woman that said, I don't know how I'm going to pay my rent. And, I was going to give her $100, but then I thought that she would think I was trying to, to take advantage of her.
Oh,
so I just
God.
gave her 100%.
You're Tiger Woods? Tipping tipping diner waitresses.
Imagine getting $100 and you're like, am I supposed to suck his dick?
Yeah, oh, God, now I got
That's
it.
what I was worried about.
All right, yeah, they just walk up. All right, pull the zipper down. You're like, no, I'm just trying to help.
Did you see my ad?
Yeah. It's, I'm going to announce this, that any waitresses, young waitresses that want to send a picture and a description of their job, want to come work personally for me, serving me food, you can live at the compound, and I will tip you. But send pictures, please.
Yes, I like that.
Of course, I'm kidding. Are you a cam girl? Come over the house. We'll have you set up cameras. We'll do a quarantine cam girl thing while Dave is staying over to do the show from the basement.
And I'll say, don't touch my food.
Don't touch my food. Touch this.
Dirty fingers.
Dr. Steve, you are a national goddamn treasure. I love talking to you, and
likewise,
you've helped us out with our various shows over the course of the decades, and it's greatly appreciated. Thank you, sir. Stay safe, and we'll listen to you on every other show because people love you, man.
Yeah, he's the
got
best.
this knocked. People just love how Dr. Steve does. He's a very you could put things in layman's terms, which is very important at times like these. And
for people like me,
you're awesome and funny. Thank you, Dr. Steve.
Bernie and I was on Bernie and Sid recently, and I got to get a drop of this because they said, this guy was on Opie and Anthony. You look at his resume, you'd think he's a clown.
Thanks,
okay.
right? Yeah, hey, thanks. I'm an actual doctor, motherfucker.
That was funny.
Be well, Steve. I'll
right,
keep in
you too.
touch, and have a good one, man.
Okay, take care.
There goes Dr.
Thank you, sir.
Steve. Dr. Steve.
So we
Wow.
got him on because I was talking to him
awesome.
today,
Yeah,
and it's like there's so much misinformation on both sides. Because I even read stuff if I can pull out my phone because I'm curious.
Do it. That was my hypothesis. I believe it's a buildup of fluid in the lungs.
In your balls.
There's a lot of fluid in your balls, and what you need is for Dr. Steve to come and drain the fluid from your ball.
Let it drip.
Love Dr. Steve. He's a good shit. Yeah.